feel honored to address you today on behalf of Terrewode as a beneficiary organization. I express deep gratitude for your long-standing support that has significantly contributed to the impact we are making at Terrewode in Uganda towards improving the lives of the vulnerable women and girls. Over the past financial year and in the current, financial year, with your generous support, we have been able to make the following notable milestones. We have provided holistic and patient-centered treatment to 387 women and girls in the last period at Terrewode Women's Community Hospital. And this is really amazing. We continue to render routine services to these women. And we are now serving women not only from Teso and the immediate neighboring communities, but the entire Uganda. We are receiving referrals, especially from Western Uganda, which is our new region of scale-up. We also provided treatment to Terrewode partner health facilities as our core activity that financial year, with a total of 592. We provided 205 at partner health facilities and 387, which brings to total 592. We have continued to render reintegration, dedicated, individualized reintegration services to the survivors of fistula. And we recruit these survivors not only from the ones treated at TWCH, but also from other partner health facilities. In total, we reintegrated 449 survivors. We trained 100 of these survivors as activists now, and they are engaged in advocacy and lobbying local governments to provide enforcement to policies that promote maternal health, and also to increase budgetary allocations on maternal health. Well, we are yet to see the actual outcome of this engagement, but we are really so excited that we've resumed this local activism at a very high level. Also, to celebrate and rejoice with you, this financial year, we received recognition for Terrewode Women Community Hospital by the Ministry of Health in Uganda. This national recognition recognized TWCH as the private health facility of the year. This was during the Heroes in Health Award, with over 10,000 nominations across 15 categories, with a judging criteria that included driving into TWCH impact. What's the impact TWCH has made? Collaborations, leadership, as well as the barriers, especially in the health sector, that TWCH has overcome since its commissioning in 2019. We are also very big now on research, with 3 research projects currently ongoing, and really we hope to even do much better. There is just so much that we could share, but because of the time that I have, I would like to bring you up to speed on what is currently ongoing and our plan for the next half of our current financial year. But just before I get there, I would like to inform you that TWCH today has 3 gynecologists, with 2 of them resident doctors. One of them is a medical director, 1 resident doctor, and another visiting specialist, but who is more regular than our consultant visiting doctors. So in total, at any given point now, with the visit of Dr. Fekade and the visit of the local, the national surgeon, who is also a FIGO trainer, we can, at any given time, have up to 5 of these doctors. Specifically in January, between January and June, and perhaps even the end of that calendar year, we hope to focus more on meeting our target. Our annual target at TWCH for treatment remained at 400 women. And so we are still focusing on that. We are also diving into serving the rare population that has not been benefiting from our services, the women with incurable fistula, or perhaps the complex women who require medical management options like the incontinence clinic and the urodynamic clinic. It's not really a service that we are in a hurry to deliver on, but there is need. We are receiving patients and we are constituting a committee. We are developing standards on how we are going to select these women and give them the services in the incontinence clinic. We set up the clinic about a month ago, but we are now really focusing on developing the standards for delivering this kind of care to the women and putting the structure in place, like maybe a management team with the technical team on deciding and approving whether the patient really must benefit from these clinics. So this is now our focus for the next 6 months. We are also going to focus still on community empowerment of Fistula Solidarity Group members. We have 44 Fistula Solidarity Group members, majority of them from the region where the hospital is located, but we are also building the similar structure in the community, in the new communities of program expansion. This is really to sustain awareness at community level and also do grassroots level advocacy, engaging with the local government leaders to enforce the policies, the laws that are there. But also during the next 6 months, we have received a request by the Ministry of Health specifically to guide them on a policy paper on how to prevent obstetric fistula and other childbirth injuries. Every strategies that have been developed does not seem really to lead us to eradicate fistula in our countries. Also, we are starting to really prioritize finalizing a concept for phase 2 of Terrewode Women's Community Hospital. I think some time back, I talked to you about phase 2, which is the establishment of the maternity model for Uganda. So it's not just coming in as any health facility, but we want to make it a learning, and from it we'll be able to see how to promote its replication to support reduce maternal mortality and neonatal mortalities in the country, as well as obstetric fistula. I think really this is all that I would love to share with you. And there are many more, but I really appreciate this time. And again, I would like to extend our heartfelt appreciation on behalf of our board, the board of governors for the hospital, the staff, and the women and girls that we serve, and the entire community of Uganda. Your commitment has been pivotal, and we anticipate creating even more impact together with Worldwide Fistula Fund. I wish you a wonderful deliberation. Thank you very much.